Greetings from Team Digital Indian Medical Association. I am Dr. K.K. Agarwal, incoming President, National President of IMA and currently the Honorary Secretary General, Indian Medical Association. Welcome to our weekly show, and every Thursday 3 to 4 p.m. where we discuss one particular subject, which is being initiated in association with Librate, our digital partner, and eMedinexus, our webcast partner. This program for the next 1 hour will be available on our IMA website for the next 1 year. You should be able to watch it. You can also ask your questions to my phone number 9811090206 or on the Facebook page of mine, Dr. K.K. Agarwal. You can ask questions live with that. So today we are going to discuss an important subject. There is a government scheme in association with WHO, second chance is second decade. Yes, I'm talking about adolescent care. And we have with us Dr. Sushma Dureja from Ministry of Health, Government of India. She is the Deputy Commissioner, Adolescent Health, Ministry of Health and Family Welfare. Welcome to our show. Madam, we talk about a slogan, second chance and second decade. Just explain about it.
Yes, very rightly said, Dr. Agarwal. This is a sentence which has been coined by WHO, which clearly means second decade, as we understand, is the 10 to 19 years of age, and we are referring to the adolescents. And second chance we are saying because the first chance was when the child was born. There was a question of survival of this newborn. Second chance means it's the time to thrive. That is, if we go by the dictionary meaning of this thrive word, is to grow, to develop. And this is the age, 10 to 19, the adolescent, which has an opportunity to develop, to grow, if given proper conditions. Conditions in terms of education, health, and development. That means, in other words, our policies, our programs should be directly directed towards these adolescents if we want them to thrive. Taking it further, let me tell you, in the recent years, there has been a lot of focus on adolescent health globally.
Before that, what is the definition of adolescent?
Adolescent is any human being between the age of 10 to 19.
Now there is a conflict because 18 is the age for child sexual abuse, you have 18, marriage age for consent. Everywhere there is 16, 18, 19. Why can't there be a fixed age?
Yeah, this is by WHO. What standard WHO definition for adolescent is 10 to 19, and Government of India is also following the same, 10 to 19.
Okay, and further you were talking?
Yeah, I said recently there has been a lot of focus globally on this adolescent health. Even the UN Secretary General talked about adolescent health. It's not every woman, every child. It's now every woman, every child, every adolescent. WHO again is bringing a lot of focus on adolescents in the World Health Assembly, which happened in May 2016. There was a lot of discussion on adolescents. Similarly, in our own country, we have taken this adolescent issue in a big way. Not only the health ministry, but the other ministries are also working on the adolescents.
The total percentage of people in the adolescent age care?
It's around 22% in our country. And let me tell you a very interesting thing. Though we are number 2 as far as the total population goes, we have the highest number of adolescents across the globe. And if we talk in terms of absolute numbers, it's 253 millions or 25.3 crores. So
they are the backbone of the society.
Absolutely. And if it today, and as such, our country is in a state of where we have a huge percentage of these adolescents and young people. And today if we invest in them, as I already said, they'll bring demographic dividend, as we call. They'll boost our economic situation over the years to come.
I want to tell you a small story. I am a mythological writer.
Okay.
And I do a lot of correlation of mythology with modern medicine.
Mm-hmm.
When I go back to Krishna's story, in Srimad Bhagavad, not Bhagavad Gita. In Srimad Bhagavad, Krishna is shown as Makanchor. That means the first 5 years of life, a child is like purity. He is pure consciousness, he is pure soul. Makan represents purity.
Purity.
Then at 5 years, he has to control Kalya, not kill him. Kalya in mythology signifies duality of mind. That's the time mind starts developing. And therefore, he has to control his mind. Therefore, he has to go to the school to learn and to control the mind. When he is in the school, his intellect starts developing. Radha kyun gori, main kyun kala. And then he starts getting conflicts, what to do, what not to do.
Yeah.
Okay.
It's a very impressionable age.
And that starts the age of adolescent.
Yes.
And during adolescent, he needs to control the Indra, which is intellect, who is sending rains, which are turmoil of your thoughts.
Yeah.
And that pahad is your what to do, what not to do, your delusions. And with one point of determination, that means you decide on that day, this is what I want to do. So adolescent is the
Determination,
age, decision making. When you decide, the turmoil disappears and everybody gets protected. So that's Govardhan Puja with that. And then when he kills the ego, which is Kansa, he kills the ego, then Radha means physical body and Krishna means consciousness. They become together with flute, that is pure, that is madhurta, humility. And once that happens, he becomes a perfect adolescent age finishes. Now he doesn't need a flute because that becomes a part of him, Radha becomes a part of him, and he acquires chakra to take decisions, and he enters into the second phase of his life.
Absolutely
So
right.
therefore,
Same is true today also.
Yes.
These adolescent is a very, very impressionable age, and adolescent is no longer a child, but he is not an adult. He doesn't have autonomy. He or she doesn't have the agency to do the things. It's a stage where there is always a conflict. He or she doesn't want to listen to the adults, but doesn't have his or her own decision-making power as well. And as if we talk in medical terms, it's a very healthy stage of life. But there is so much of vulnerability associated with this age that if we do not guide them in the proper way,
they can move anywhere.
They can move anywhere, and the conditions that they can land themselves into do not only impact those years, but they may have a long-lasting effect in their adulthood also. So this is the age where they are easily moldable. They do not have much of their own well-developed thought process, and they need lot of guidance.
So if I have to divide, when we talk about, you have a Deputy Commissioner Adolescent Health, what are the focus areas in your program at a national level? Because I know that you had inaugurated last year the whole program of Adolescent Health.
Rashtriya Kishore Swasthya Karyakram.
And that our Priyanka came to inaugurate that as a brand ambassador at that time.
Yes, that was the WIFS program that we had.
So suppose I want to talk about the Ministry for doing Adolescent Health, and if I want to replicate it in the private sector, in the Indian Medical Association, just explain to me the concept in the government sector, and then try to see how this government sector can be presented into the private sector. A similar thing with slight changes.
Okay, let me date back my conversation to 2006, when firstly Government of India thought of having some program for the adolescent. That was called, many of my colleagues must be aware of this URGE program, Adolescent Reproductive and Sexual Health, that was introduced way back in 2006. But that had major focus on reproductive and sexual health and to some extent nutrition. But very soon we realized that vulnerability of these adolescents are much more than the reproductive and sexual health vulnerabilities. If we look at our data, if we try to analyze, if we look at various surveys, we found there are 6 main areas or focus areas where we can concentrate or we can project our program to be. As I said, nutrition, then reproductive and sexual health, then, if you'll agree with me, mental health, injuries and violence, substance abuse, and last but not the least, non-communicable diseases. They are all areas of concern, not only for these adolescent years, but also when these adolescents become adults. So we have drafted our program, or we have come up with a strategy, adolescent health strategy, and then rolled out our RKSK, Rashtriya Kishore Swasthya Karyakram, where we take care of all these 6 focus areas. Now, we do not want to restrict ourselves only to curative part. There has been a paradigm shift. What we are focusing on now is the promotive and preventive healthcare approach. We do not want to wait for the disease to happen or the conditions to actually happen so that we take curative steps. So that is another paradigm shift. Another thing, earlier what we used to have in URSH program, we had the clinics, URSH clinics, and we waited for the clients or the adolescents to come to us with problems. Now we are reaching out to them in their own spaces, where they live, in the community, in the schools. हाँ, कुछ भी कह दीजिए, पर हम ये समझा रहे हैं कि अभी तक तो if you look at the program, तो पहले जनरल परसेप्शन इज कि एडोलेसेंट है, हेल्दी है, इसको क्या जरूरत हो सकती है, पर क्या क्या दिक्कतें आ सकती हैं, पेरेंट्स और कम्युनिटी दे डू नॉट वांट टू अंडरस्टैंड, रियलाइज और वर्क ऑन इट. So our main aim is to sensitize not only the adolescents but their parents, their caregivers, or for that matter any and everyone who is associated with these adolescents. Even if we talk of the villages, Panchayati Raj members, elected representatives, everybody must understand adolescents, though considered healthy, are vulnerable. We need to work on them. So these are the situations. If we taking it further, let me add, NCDs are becoming a major concern. But how many of us realize that majority of these NCDs have a beginning during adolescent period?
That's what our cardiologist says. You always say
cardiovascular diseases,
everything.
Cancers.
It takes 20 years for them to manifest.
Yes.
So it has to start in the adolescent age.
Adolescent. And our adolescents at the moment are worst affected over the last few decades. Physical inactivity, dietary mismanagement.
And we are getting heart attacks at age 30.
30.
That means they are starting lifestyle
Absolutely.
at 10 or 20. Yes.
Tobacco smoking, alcohol intake, all these are happening so widely in our adolescents. If we do not take care of all these issues,
so let's do quickly. Let's talk about quickly about all these 6 of them.
Yes.
Then we try to come out with some formulas with that. What about nutrition? What is our highlight on nutrition?
Highlight on nutrition.
There has to be 1 or 2 lines.
Yeah.
So that we can.
Yes.
So what are we? We are basically talking about in nutrition. What?
Nutrition. Let me say, obesity is becoming a challenge, especially in the urban areas. But at the same time, malnourishment is another challenge. More than 50% of our girls and about 50% of boys are underweight. Or even if they are taking adequate diet, the proportion of the different components of the diet is not appropriate.
What is our recommendation?
They should take a full, wholesome diet.
I know, I agree. But then, and again, somewhere, something has to come very simple in the private sector. Because doctors have no time to read.
The private sector can come up with simple depiction charts. A thali in 3 colors. Green vegetables.
No, we normally say all 7 colors 6 taste. That's a balanced diet. Your
Yeah,
diet
absolutely.
should- so all colors, moderation and variety.
Absolutely.
All 7 colors, 6 tastes.
Absolutely.
So it will cover everything.
Absolutely right, sir.
Because every color becomes vitamin, everything gets covered.
Yes.
That's what we say.
Iron
Second
deficiency.
thing, what we promote is gur,
Chana.
murmura, oil, and mungfali.
Absolutely
Now,
right.
gur is all minerals, including iron. Chana is protein. Murmura is carb, and which is high glycemic index called. Oil is calories and fat, and mungfali again is fat. And if you take this, anybody who can eat that is not poor.
Yes.
Because by healthy he will be healthy. So this will cover most of, whenever you are take your food, but in between take this as जब भी चरने का मन कर रहा है तो इसको चरो.
बिल्कुल ठीक कहा आपने. बहुत सारे ऐसे देखते हैं those families which are quite well off financially but they do not have enough of information what all to take.
So therefore, suppose if I want to do, I'm only trying to find out is that in my private sector, if I take a program, what I would like from IMA is, you're talking about 1, 2, 3, 4, 5, 6.
Absolutely.
Now, you as an IMA member, think of how IMA can participate with you. Let us make 6 videos. Nutrition in adolescent, reproductive and sexuality in adolescent, mental health in adolescent, injury and violence in adolescent, substance abuse and NCDs prevention. We make 6 videos of say half an hour each or 20 minutes each for doctors. And simultaneously we make 6 videos for public.
Yes.
Okay. Now these doctors will go through this video as and when to revise themselves. And these 6 videos are available with every doctor in their clinic.
They can have a look. They can show it to the public.
No. Every adolescent patient who comes to him, he cannot go for a consultation without seeing one other video. Next time he sees second video, third time he sees third video. So all those adolescents who are their patients,
Absolutely.
so they have to see the video before the doctor sees that. This can become like a IMA policy, that the patient who is sitting outside has to watch one of the videos.
It may be the adolescent, it could be the parents also.
I said anybody.
Anybody who's...
I said when we IMA work, it will not be only these 6 videos.
Yes, absolutely.
We will have videos for other diseases also, for other programs also. But in this program, we can come out with a single video of 20 minutes, which talks about all
maybe
6 of them.
Maybe 30 minutes, 5
which
minutes
talks about all
yes,
6 of them. And that give it to the patient. If he wants to take a copy, let him take. It's available on the website, available everywhere.
It could be even on the YouTube.
It can be YouTube. All these things will be happening with that.
Yes.
So this is something where I would like you to think over it and propose it. This is what IMA should do.
Yes,
This
definitely.
is what IMA should do. And then with IMA, get it prepared. And then we see the results after 1 year, that how much it makes a difference.
I'm sure it will bring about beautiful results.
That's what I look at it. So therefore diet, we basically come back with a mix of variety and moderation. So don't eat less, don't eat more. All 7 colors, 6 tastes. And then for poor people who can't afford gur chana, mungfali, oil, or a variation of that, mungfali you can replace it with the kaju, whatever you want to do.
Yeah, and as far as possible to stay away from the fast food and aerated drinks.
No, I will slightly change from you. I want to promote fast food,
Reason?
not the junk food.
Not the junk food.
Fast food is fruits. Take an apple is the fast food. Fast food is ready-made.
Ready to eat.
Ready to eat. So
Yeah,
milk,
junk food, avoid.
dahi, banana.
Yeah,
peel
then we
it and
change
eat.
the fast food to junk food.
So,
Yes, absolutely.
Fast food to be taken.
Yeah.
Take a milk, boil it and take
Absolutely.
it. That's fast food.
Junk
That's
food.
the fastest food.
Junk food to be avoided. Let
Junk
me be
food,
very
yes.
clear.
And
Junk
then-
food to be avoided.
I don't again want aerated drinks.
Yeah.
I don't want that concept. IMS concept, I'm trying to say. Our concept is anything which contain more than 10% sugar, avoid it.
Avoid it. Yes.
So that includes mithai. Otherwise what will happen is they will stop aerated drinks, but they will start eating balushai, which is 50%, say rasgulla has 50% sugar. Jalebi has 50% sugar.
And oil also.
Ah,
And fat also.
and fat also. So therefore they are, if there is a choice, they are more dangerous than aerated drinks. So our job has to be
Yeah.
that your drink, anything eatable or drink or anything,
Let's not say no to them, but they should be taken in moderation or
less
as
than 10%, more than
Yes.
10% avoid it.
avoid.
Less than 10%. Now, what will happen with that is the companies will be forced to bring 6%. Now 3% is your ORS. 2.5% is ORS. Now the companies will be forced to bring aerated drinks at 6%, 7%, 8%. So at least you shift them from 12% to 6%. That should be the campaign. Because still 6% will be as tasty as 12%.
The directions are coming for the school canteens also.
Yes, that's what we propose.
Yeah,
to that.
school canteens also should
from
be serving.
diet we go to reproductive and sexual health. Yes. What are the points?
Reproductive is a very difficult area.
You have to draw 5-6 points.
Yeah, difficult area in the sense it's very easy to preach, very difficult to really see that the things are happening. I'll not say no sex, but safe sex. That is one thing we can always talk about.
So we have a slogan which was created by one of our IMA member in Mumbai. एक से अभी नहीं and एक से कभी नहीं.
That's very right.
Postpone the first one.
Yeah.
Okay? And then
Single partner.
Second for ABC, that you be faithful to your partner.
Be faithful.
And if you can't, use condom.
Absolutely right.
Yes.
Safe sex, that is exactly what I said.
I know.
We cannot preach, don't have. We cannot be the model police.
So be faithful to your partner.
Yeah, that's
We don't say
enough.
be faithful to your partner. If you can't, use condoms.
Use condoms.
Or use safety measures.
And another thing which may be relevant, not much for the urban areas.
And then
but
sexual
for
hygiene.
Sexual hygiene.
This is the third point we talk about is
absolutely.
sexual hygiene.
Then another thing that we can talk about may not be very relevant for the urban areas, but rural areas, right age for marriage.
Yes. What is the government recommendation?
18 years for the girls, 21 years for the boys. And another more important than that is the right age for first childbirth. It should ideally be at the age of 20 or after that. Because as doctors, we all understand complications, morbidity, mortality, both for the mother and the child, increase when the age of the mother is less than 20. You'll be if you talk about how many of our girls are getting married before the age of 18, is the latest data that we have from 2013-14 is more than 30%. It used to be 43%. Now it has come down to 30%. There has been an improvement, but still it's very large. And around 17% of our births are happening in girls who are less than 19.
So teenage pregnancy is 17%.
It's always.
We'll talk about it. Then again I go back to mythology. But again I'm going to tell you a story. There is our mythological story about Santoshi Mata Vrat. And they say that those ladies who are marriageable or child producing age, they have to do this vrat. And if they don't do this vrat, उनका बच्चा मर जाएगा and उनका पति उनको छोड़ के चला जाएगा. ठीक है. Now if you go back to the modern medicine's equivalent to Santoshi Mata Vrat, in Santoshi Mata Vrat you have to eat good, you have to fast, you have to eat good and chana every week for so many weeks, so 3 months, 6 months. Then you have to do. Now good is iron, chana is protein. So if you take good and chana every week, and in a fasting state, iron is absorbed better, therefore fast. So for 3 months or 6 months or 1 year, if you continuously eat good chala, your iron deficiency improves. You are no more iron deficient.
Yes.
You are no more protein deficient. So your fertility increases. Chances of your development of the child increases. Okay. And then if you are having anemia, you will not be able to satisfy your husband. But if you don't have anemia, so you will be able to satisfy your husband. इसलिए पड़ोसी के पास नहीं जाएगा. If you are having hemoglobin of 6, he says that she becomes breathless, she will go to somewhere else, and then you will not have abortions. इसलिए बच्चे नहीं मरेंगे.
ठीक है. So it's very very relevant.
So it's relevant. So therefore we say संतोषी माँ का व्रत करो ना करो फर्क नहीं पड़ता. But every Friday eat good chana.
Good chana, absolutely.
So all women in that age group, including adolescent girls, once in a week good chana खाना compulsory है. That's IMS campaign. Once a week good chana. Once a week good chana. Promote that. That takes care of most of the things. Instead of giving
And
iron.
also IFA tablets that we are giving to.
I said, oh, that is okay, but then
that
lot of
is-
resistance is coming. For
That
the
is
tablets.
just only a part of our program. What
But
we
then
talk
Bhojana
about.
is something which
Absolutely
will give you
right.
calories, other minerals,
Absolutely.
another thing. Now let's come back to mental health.
Yeah. There's a lot of stress for the adolescents. Studies, relationships, and now the working parents, they hardly get their parents to talk to. Depression, anxiety, suicidal tendencies, this all we are coming across practically every day. And what is more alarming is the increasing incidence of these psychiatric problems. There's almost 10% increase in the number of deaths which are happening because of these mental illnesses. So a lot of support is needed, counseling. It could be anybody, parents, they are the best people to counsel, or our medical professionals. Lot of, many a times a child may come, adolescent may come to us with some pimples, this pain, that pain. But if the doctor has enough of time to probe into his or her problems, they ultimately catch the point. The child is mentally disturbed. Poor performance in class, what is the reason? Maybe some sibling rivalry or some issues with the friends in the class. So all these problems.
I agree. For this, IMA is starting a campaign this year called Bar Bar Pucho.
That is very
Bar Bar
important.
Pucho means every time you have a child, ask him, are you okay? Are you getting disturbed? Any problem
Yes,
with
absolutely.
school? Any problem with smoking, alcohol, addiction? Everything.
They all come
so
together.
every time to presume that every child has a mental stress. So Bar Bar Pucho. Every time you ask,
Absolutely.
someday he'll open up.
Someday he'll open up.
Someday he will
But
open
before
up.
it should be too late. Before it is too late.
But then, see, actually, at the moment nobody is doing it.
Yeah.
If you Bar Bar Pucho means whenever he comes to you, you ask.
Yes.
That's the only thing you can
Ab
do.
kya ho raha
Similarly,
hai?
child sexual abuse, that's a major problem. And that has to be, unless you ask proactively, the child is not going to come out. And then you need to take care when you talk, you need to see parents are not there. You have a girl counselor with you who can do that. But my question is that most of us are not trained how to handle. The handling of a child is an art.
Yes.
Handling of a
Counseling
child is an
technique,
art.
counseling.
So therefore, we need to talk, we need to have standard videos doing counseling on various issues available on our website. If you tell a person, hire a counselor, no, because no counselor will charge less than 600 rupees and doctor's fees is 150 rupees. It's a conflict in the private sector. Because doctor says, we are doing charity, we are seeing you in 150 rupees. How can I refer to somebody who is not a doctor and who is going to charge 500, 600 rupees? Minimum charges of a counselor are 500 to 600 rupees. Therefore, we need to have a concept of these counseling sessions, how to do them. We need to train our doctors.
Yeah,
And we have to tell them that counseling is chargeable. See, in a CGHS, for example, you have to come back and tell to the ministry that they have to approve counseling charges in a private sector. When CGHS approves it, then private sector also adopts it. Unless the counseling session is chargeable, nobody will spend time.
Okay. To help
Even if health ministry comes out and say that counseling is not consultation.
it is much more
No, it
intensive.
is not consultation.
It's
It
much
is a
beyond
procedure.
that. Yes.
It is a skilled procedure.
Skilled procedure.
Therefore, like a procedure, private sector can decide their charges. But if you are going to say this is a part of the consultation, no doctor is willing to spend time.
Absolutely. And it's
So,
time consuming.
It is time consuming. So it is
Yes.
not a consultation. It is a skilled procedure. Now, narration exposure therapy, now this cognitive behavior therapy, progressive muscular relaxation, all these have now become procedures in psychiatry. And even stage 1 hypnotherapy, they all have become
Procedures.
procedures,
Specialized procedures.
specialized for which people
Yeah.
pay separately. This here what I am saying is, therefore, when you are sitting in your office, sometimes you have to think from the IMA mind, and when you are sitting on the IMA, you have to sit from the Ministry of Health side, so that we come out with a common
Point.
point.
Yeah.
Because otherwise what will happen is ये क्या है, ये तो डॉक्टर तो लूट रहे हैं, उन्होंने 10 मिनट बात करी, पैसे ले लिए. So we need to come out that counseling, we need to give it a term, and we need to call it as a skill procedure.
Absolutely right. To help the practitioners right now, you talked about the counseling procedure, how to do it. Everybody may not be very comfortable doing it. The immediate help can come in the form of some material that we have on our website that we have developed for the counselors.
It has to be in a video form. It has to be in a short video for doctors.
What I can suggest, that material can be developed into a video.
Yes, this is what I'm saying to say.
Yeah.
See, doctors are, most of us have a time while we are traveling
Yeah.
to listen.
Absolutely right. Those, what I'm suggesting, that counseling material, what we have on our website, that we have developed for adolescent health counselors.
Absolutely.
Counselors can be converted into a video and it can be used.
And with these videos, we can tell all our branches in India that whenever there is a CME, whenever the speaker is delayed,
they can play this video.
Suppose it's a 5 minutes video.
Yeah.
Whenever there is a break, play this video.
Yes.
So it requires, and somebody who is interested, he will go to the website and watch
So I would request IMA to utilize those counseling.
No, again, take out those sessions. Sit as an IMA member. Take out those sessions. Call me. As a IMA, let's convert them into a script.
Okay.
And then let's see how we can convert it into a video.
There are beautiful role plays.
Yes.
There are how to conduct a counseling session, what are the barriers, how to overcome those barriers.
Convert them into videos with us.
Yes, absolutely.
Convert us with the videos with us. Define it for a general practitioner in a simplified language, and let's promote them.
Absolutely.
Let's promote them. That's the way I look at the whole thing. Now comes from mental health, injury and violence.
Injuries and violence. If we talk about 15 to 19, these injuries and violence are the foremost cause for deaths. Highest number of deaths in this age group, 15 to 19, are because of injuries and violence. And in the younger adolescents, that's 10 to 14, they are the second commonest cause for deaths. Aggression, bullying, self-harm, threatening, all these things are seen as a part of injuries and violence. Drowning, all these things.
So if I have to classify them, I will take them in mental health again.
They are all interrelated.
With each other.
Intake of alcohol.
For me, substance abuse, alcohol, smoking, they are all
interrelated.
They are all interrelated. Again, come back to Bhagavad Gita, where Krishna says to Arjuna, Dhyayato Vishya Napunsa Sangastoshya Pujayate Sangha Sanghayate Kamat Krodho Vijayate. He says, non-fulfillment of desires leads to anger.
So anger leads to violence.
Anger leads to aggressive behavior. Aggressive behavior leads to delusions.
Yeah.
Krodha Bhavati Samoha. This is what he talks about. So basically, the cause of anger and violence in children is non-fulfillment of their desires.
Yes.
Therefore, in Bhagavad Gita, very clearly, the first chapter, when Arjuna is in problem, मेरे पैर लड़खड़ा रहे हैं, मेरे हाथ पैर कांप रहे हैं, मुझे समझ में नहीं आ रहा मैं क्या करूं, तो Krishna only listens to him. In the first chapter, he doesn't speak a word. If adolescent is listened, violence reduces.
You know what is happening? Our societal structure is changing very fast. The joint families have got converted into nuclear families. Both the parents are working. The child goes sometimes without a tiffin. He eats out the junk food. Coming back, there is nobody to listen to the child. And there is so much of peer pressure to indulge into smoking, drinking, and so much of academic pressure to achieve well. All these things are putting the child in such a circumstances, unless that adolescent is really supported well.
I normally again go back to the Upanishads. I say every child needs 5 things. One is physical pyar, jadoo ki jappi. Jadoo ki jappi. Physical is not only sexuality. Then he needs mental, कि कोई रोने का मन कर रहा है तो बंधा चाहिए. Then he needs intellectual partner, that if he wants to talk about मोदी जी को क्या करना चाहिए, you should be listened. Hey, तेरे को क्या लेना देना, तो बड़ा हो जाए तब सुनेंगे. तो he needs to be listened to. Then egoistic, he says कि मुझे prime minister बनना है, so we need to encourage him. Somebody needs to take away his insight, talents and help him out. And then he needs a soul partner, somebody's company. Whenever he is disturbed, he should
somebody
feel
to
relaxed.
solace it.
Somebody to
Solace.
solace it. So these are the 5 requirements. Any of these requirements, if not fulfilled, leads to violence.
Absolutely right.
It leads to violence.
And these are all
सुनता ही नहीं,
interrelated.
मेरे को सुनता ही नहीं, गुस्सा. ठीक है, मेरे को कैसे स्नैप कर दिया, मेरी क्यों नहीं सुन रहे,
किसी
गुस्सा.
को मारा, किसी
मैंने
से
बोला
झगड़ा
कि मुझे
किया,
मैंने इलेक्शन लड़ना है, मेरे को बोल रहे हैं कि तू बच्चा है, मैं बच्चा थोड़ी हूँ, लड़ाई.
बड़ा हो रहा हूँ मैं.
So these are, I mean, these are all answers available in our Vedic books. So IMA would like to correlate them with Vedic structure so that it incorporates.
You know what we really say is the life skill education.
Absolutely.
But these are the focus areas that we have identified. That is more for the administrative purpose. Reason being, maybe a particular state has one of these issues as the foremost issue. So some states have, so you say, substance abuse as a major area of focus. Maybe they want to focus more on that. So it's a guidance tool for the implementing states. But if we look at child as the main subject, we have to give life skill education, which includes everything.
Now we come back to substance abuse. We talk about drugs, smoking, alcohol, cocaine, and then all types of things. What are the messages?
I'll say stay away. Resist peer pressure. That is the main thing. Stay away. There's no...
Something more has to be done in the private sector because the prevalence is too high. The third page parties, the type of... The use of cocaine is so high in the...
You know, we cannot put a limit. Okay, this much is okay. These are the substances which are harmful even in small quantities because they are addictive. Today, suppose a child starts with a small amount and he becomes habituated, addicted. Maybe tomorrow he'll try a larger amount, maybe another substance. And these smoking, alcohol, drugs, they lead on to various other problems in life.
See, normally when there is a depression, so you have low serotonin, so you try to increase serotonin level, SSRI. Or you have low adrenaline, then you have drugs, dual acting, they also increases noradrenaline. Now the triple drugs are coming which also increases dopamine levels. So you have all the 3 combinations and all these drugs.
But as doctors,
do
we say one should be taking these drugs?
No. All these drugs increases all 3 levels.
Yes.
Therefore, these drugs, for them, is a treatment of depression, which we are not realizing. We are saying depression is common. For me, everybody who is indulging into substance abuse, somehow he is depressed, he needs counseling, he needs to be taken care of. He is trying to take away his depression by taking this because these drugs increases all 3 levels and he feels that my depression is
no, at the same time.
Therefore, to attack substance abuse, it has to be merged with the mental health.
They're all together. Yes. I said it has to be a very comprehensive approach.
Absolutely.
Life cycle approach.
I always find out is all those children who have a lack of these 5 needs, they end up into addictions.
Yeah, but sometimes it's peer pressure also. Many a times. It may not be actually depression, it may not be actually anxiety. It is because to have a place in the group, because you don't want to be,
ego.
You do not want to be.
Ego. See, again ego. घर में या स्कूल में कोई उनकी ईगो सेटिस्फाई नहीं कर रहा, वो बाहर के ग्रुप में जाके दिखाते हैं कि मैं तुमसे ज्यादा स्ट्रांग हूँ.
हाँ, कि सब पी रहे हैं, सब ड्रिंक कर रहे हैं. अगर मैंने स्मोक नहीं किया, ड्रिंक नहीं किया, ड्रग्स नहीं, तो I'll be the odd one out. I have to be a part of this group, and this group is being considered as superior to the others, and I want to show my superiority, so I have to be a part of this group. So all this conflict
So there are some people have desires to take. Some people say छूटती नहीं. Some people say ego. Why not me? Why not me? मैं क्यों नहीं?
किसी का कुछ नहीं बिगड़ा तो मेरा क्या बिगड़ जाएगा? मेरा क्या बिगड़ जाएगा?
Now we come back to the NCD.
You know, 18% of, if you look at the total tobacco consumption, both smoking and smokeless, is 35%.
ये इसको लेकर हाथ लगा दो. बज रहा. 18%.
18% are in the age group of 15 to 24. So it's so high.
I agree. So if I have to see it, and I think all these 6 needs to be worked out together.
Yeah, absolutely.
And they have to link it together.
They're all interrelated.
This leads to this, this leads to this, this leads to this, this leads to this. I agree.
Alcohol intake, sexual promiscuity.
So I slightly like to go back that
and we were talking about NCDs.
Yes, NCDs, let's finish.
Yeah.
Okay.
NCDs, as I said, we are coming into that category where NCDs are responsible for majority of the adult deaths and majority of the avoidable adult deaths. If you look at the figures, more than 50% of the adult deaths are because of NCD, and it is being presumed that by 2020, 70% of the adult deaths will be because of the NCDs. And as I said earlier, majority of these conditions which lead to these NCDs have a beginning during adolescence. Physical inactivity, inappropriate diet intake, alcohol consumption, smoking, use of drugs, all these have a beginning in adolescence. So this is the time when we nearly need to work with these adolescents to avoid occurrence of these NCDs in the adult life. And let's not presume that it happens only in the developed countries. 80% of the NCDs are happening in the low and middle income groups. And this
more on that, because they have not pot belly obesity, insulin resistance, hyperinsulinemia, metabolic syndrome. Is much more in normal weight people because of centralized obesity. That's happening with that.
And it's becoming much more common in India.
I have a formula here. My formula is K.K. Agarwal ka C ka funda, formula of 80. That this is applicable to all ages. That your दिल की धड़कन, नीचे का ब्लड प्रेशर, गंदे कोलेस्ट्रॉल की मात्रा, फास्टिंग शुगर और पेट की चौड़ाई, सबको 80 से कम रखें.
Very good.
ठीक है. दिन भर में 80 मिनट चलें, 1 मिनट में 80 कदम चलें, 1 हफ्ते में 80 मिनट तेज चलें.
I think I'll also note it down.
I'll give it to you. Then no smoking, no smoking, 80,000 रुपए का bypass हो जाएगा. No alcohol if you take less than 80 ml. 80 साइकिल रोज की प्राणायाम करो, deeper and slower breathing. साल में 80 दिन धूप में बैठो, साल में 80 दिन फास्ट करो.
Oh, very good.
ठीक है. Noise pollution 80 से कम, air pollution 2.55 को 80 से कम. जिंदगी के अंदर में 80 बार सेल को डोनेट करो, तालियां बजाओ तो 80 बार, लोगों को दिन भर के अंदर में 80 लोगों से बात करो, अप्रिशिएट करो, सब कुछ करो. उसके साथ में अगर ऐसा करोगे तो 80% चांसेस है कि आपको हार्ट अटैक नहीं होगा.
ये 80% चांसेस है आप 80 साल से ऊपर जियोगे.
और अगर आपको हार्ट अटैक हो भी गया और अगर आप मर गए तो 10 का फार्मूला याद रखो कि मरने के 10 मिनट के अंदर अर्लियर द बेटर, कम से कम 10 मिनट तक लॉन्गर द बेटर, 10 into 10 100 पर मिनट की स्पीड से अपनी छाती पीटने के बदले मरे हुए आदमी की छाती पीटो. ऐसा करोगे तो 80% चांसेस है मरे हुए आदमी को जिंदा कर दोगे.
वेरी गुड. और कम से कम 10 ऑर्गन्स डोनेट करके जाओ. Let me add that.
Yes. 10 वाले फॉर्मूले में आ जाएगा.
10 ऑर्गन्स. हाँ.
और फिर भी अगर मर गए तो 10 ऑर्गन को डोनेट करो.
डोनेट करो. आइस करो.
Yes, I know.
हार्ट करो, लिवर करो. हाँ, कितने लोगों के लिए.
So these types of things we make it for the public. When it comes to public, we can add these things. It becomes interesting. The only thing which is missing in your program is hygiene.
We do talk about it.
No, it's missing in this experiment. Because food hygiene, water hygiene, sexual hygiene, pet hygiene, sleep hygiene, mobile hygiene, and kitchen hygiene, respiratory hygiene is missing in your program. We need to include that.
Okay.
At least in IMA program, we need to
Thank you very much. A very good suggestion.
Because NCD, we are not covering
we are not covering
communicable diseases at all. So diarrhea, then food disorders, then we are not covering, because I need to cover all types of hygiene.
Hygiene is very
So if
important.
we do that, this becomes a comprehensive program for a private sector. Now, I was saying is that now how should I promote it? 25 crore people who are adolescent, who needs care. Okay?
We need to sensitize their parents, their families, and them.
I'm talking. The demand is 25 crore. We are only 2 lakh doctors who are IMA members. So for each one of us, there is a market of 1,000 adolescents. And with their parents, we have 3,000 patients. Even if we only enter into a weekly adolescent clinic,
Yes.
okay, we will take care of, they will take care of us, we take care of them. We will be able to earn money scientifically, ethically, and this is a big, it is a big service to the community and a good earning for the medical profession. That's how I am just calculating. I
Yes.
just calculated 25 crores, 2 lakhs, 3,000 patients per person.
Yes.
And 3,000 patients per person means huge number.
Huge
That
number.
means we are a shortage of doctors.
Yes.
We are shortage of doctors. So it's a good project to enter in. And instead of allowing only the pediatrician or physicians or gynecologists to look
And-
after adolescent, it
Yes.
has to go back to MBBS.
And there's nothing technical in it. It's it's not a technical procedure. It's nothing to do with all those surgical procedures or anything. It's very simple.
So I know Foxy has developed some programs on that, and pediatricians also have developed some
Yes.
programs. But we need to develop Adolescent Health program. Now I'll tell you one more thing. That IMA is launching Our School Chale.
Hanji.
We are launching a program called Our School Program. And our first program will be in 30th of January.
Okay.
Okay. And we have taken 3 programs. Hygiene, and we have taken vector-borne and CPR, first aid.
Like the bone and CPR.
Huh. So what I am planning now is, after today's thing, that hygiene I'll shift it to adolescent health. Hygiene will become a part of that. I'll include all parts of into a hygiene. So what our program is that on every 30th of the month, we are asking all our doctors to adopt schools.
Okay.
Okay? We will make a standard video and we give it to them. They can download it on the website. Suppose we are aiming for the first lecture is 5,000 doctors, 5,000 school lectures. Same day, same time, at 5,000 locations, same material to be spoken or to be shown.
Sure.
That you go, identify, you say, I am the honorary doctor to this school. Take a IMA letter, go to the school and become an honorary
That
health
will be
educator.
a great service. That
Health
will be a great
educator of that
service.
school.
Yes.
They can, and then every month give a lecture there. So what will happen is slowly, more and more doctors. Now here you can pitch in. Now DG can pitch in. So DG can come back and say that ministry can pitch in. Ministry can say that to the IMA that all our government doctors will also do the same thing.
Yes.
So what will happen is a time may come, we may have 1 lakh doctors giving lecture on the same day.
Yes.
And see the amount of
Coverage that will happen.
The rule is 1% of the collective consciousness. So if I want 100 crore society, if I am a 100 crore society, if 1 crore out of this 25 crore children.
And it's not only the children that we are reaching. Once we reach a
No,
child, we
no,
reach their parents also.
I'm talking something different. There is a 100 monkey phenomena in our Vedic literature. Out of 25 crore, 1% of that is 2.5 lakhs.
Yes. 25 lakhs.
1%.
Yes. 25 crores, 1% is 25 lakhs.
Okay. So I need to sense, no, it should be 25 crore, 100 crore में से
25 lakh हो जाएगा. 25 lakh, हाँ.
So if I can sensitize 25 lakh children, I win the game.
Yeah, absolutely, you are right.
Okay. So for me, 25 lakh children means if I have say 5,000 lectures in an assembly, 1,000 people, school children attending. So 5 lakhs.
It is possible.
5 lakhs children I can sensitize in one lecture.
Yes.
Okay. So it is possible.
And just 1 hour of the month.
I said, this question is zero cost.
Yeah.
This is voluntary cost. It's for the image of the medical profession. The cost is
And
zero.
that I'm sure
The cost
that
is zero.
the schools and the teachers, they'll be most excited to have the presence of this doctor.
So our 1700 branches can look after that as a project. Our school chale we are trying to promote.
Absolutely.
At least school health education. So this video of
Is,
the school help us out in developing it.
Sure.
Find out an agency. The government should, if you have some agency who makes
No,
it,
we do not.
find out. And you like, see, this much cost the government should bear of developing it into a video. We can make it in Nirban Bhavan as a project. We start doing it. Duplication and all our branches will do. But basic video, because you have a department, DAVP, they can develop the whole thing. Ministry has NIC, they can help us in developing it. Just develop a video with us and then we do it. This is what I'm trying to say. So I personally feel this is the best way of
Reaching out to
the people. So in
Yes.
adolescent health, school health, then we can ask, then we can have I don't mind, because it's a very good idea. I can have all the directors, if I can have producer directors list, let me identify how to get a list, and then we start sensitizing them that wherever possible, we give them 50 slogans, एक slogan picture में डाल दो. So if we sensitize those producer and directors, that we give you some health messages. So in every movie one health message comes. आदमी बोल देगा उसके साथ में जो है वो कहेगी कि क्या खाएंगे, बोले आज गुड़ चना खाएंगे. जैसे गुड़ चना क्यों खा रही है? I mean, somewhere it can be incorporated, and if that happens, the scenario will start changing.
Absolutely.
So that's a good idea. So that list of directors and producers. Anything else?
No, I think we have covered majority of the things. Most of the things we have covered. Anything more coming from you?
So, such a great piece of information. Namit Khanna, Sumit Prasad says, hi, Jaya Chandra, hello doctor, my 12-year-old son takes Dakar after eating. Although I give him some cooked food only, I am consulting my pediatrician, can you suggest any home remedy? The home remedy is very clear that whenever you get gas in your body, the answer comes in Ayurveda. Anything which is pungent, astringent and bitter is going to produce gas. Anything which is split into two equal parts like chana, dal, mungfali, badam, unko bhigo ke khao, and if you take them raw, they are going to produce gas. And anything which is under the ground, like mooli, like gajar, like shalgam, like piyaj, if you are going to eat them raw, it is going to produce gas. So therefore, either you soak them in water or have boil them and then take it. And of course, another important thing is asofetida, which is hing, is anti-flatulent. So jitna possible hai, hing ko usme daliye. Paramita Sarkar, is it true that Indian children are hitting puberty early because of adulterated milk? No, nothing to do with adulterated milk. But early puberty is now being seen.
Because of the good nutritional status.
That is good nutritional status, and more of their early sexual knowledge. They also have some hormonal changes early. Poonam Chablani, counseling and meditation should start from teenage group. You are absolutely right, Poonam. Counseling is important. In fact, if you see Ramayana and Mahabharata, the whole counseling of Rama was done by Yoga Vasishta right at the age when he was adolescent. And the Gurukul concept in our ancient age meant that they are taught the Vedic principles, whether it is Rig Ved, Yajurved, Samved or Atharved. They were all taught, which had all types of counseling and the concept of life right at the right age with that. So I think it's the time to say goodbye to all of you, and we should thank Dr. Sushma Dureja, but before I thank her, I need to have her 5 messages as take-home messages for today. 5 take-home messages for today. Speak directly on the camera.
Our take-home messages, adolescents are the group which really needs our care as a parent, as a doctor, and we have to be really patient with them, listen to them, and counseling is a very important component of our practice, and preventive and promotive components are much more important than the curative aspect, because once the damage is done, it's very difficult to undo it. We are looking at such a high incidence of NCDs, and that they'll increase much more in the years to come. Let's work with the adolescents right today so that we have healthy, productive adults after 15 years.
Thank you, Dr. Sushma. And with an end that IMA is planning to put down a modern adolescent clinic, and IMA is even willing to certify it that like we had IMA age-friendly hospitals, IMA can come out, is thinking of coming out with IMA certified adolescent clinics, which are of standard, with standard videos to be shown to the public. That's all for today. We will come back next Thursday with another topic, and of course next Wednesday, which is on 27th, 28th and 29th. And on 28th afternoon, I'll be taking over as the National President of Indian Medical Association at Amritsar. That will also have a live, and the whole Central Council meeting will also be live. And we will meet on next Thursday with some other topic. Till that, goodbye. Thank you.
Thank you very much, and it was real pleasure to be here
Thank
today.
you.